This video should not be construed as dictating an exclusive course of treatment. Variations may be warranted based on patient needs or the setting in which care is provided. This video is intended to be used at the time originally presented and is not intended as medical advice. Opinions expressed in this video are those of the speaker and not necessarily of the American College of Obstetricians and Gynecologists, nor of the companies providing financial support for this video.
My interest in infant mortality started during my public health training when I learned that the United States had a higher infant mortality rate than most developed nations. And most tragically, I learned that within the United States, there are significant disparities between racial and ethnic groups in the U.S., particularly affecting African Americans and Native Americans and low-income families, that their babies die at a higher rate before their first birthdays than other groups in the U.S. As an OBGYN, I'm of course interested in reducing the risk of infant mortality, and typically in practice, we do this by trying to provide the best care for moms and babies and helping moms have healthy pregnancies and full-term pregnancies. But I've learned there's a lot more that OBGYNs can do on the population level and at the community level. When I started practicing in Mississippi, I became involved with the Fetal Infant Mortality Review Program. Mississippi has one of the highest infant mortality rates in the United States. So as an OBGYN, I felt it was really important to be involved beyond just taking care of my patients, but see what I could do for the state as a whole. The Fetal Infant Mortality Review Program, or FIMR, is a joint program run by the American College of OBGYNs, or ACOG, and HRSA. And it's really a community-oriented, action-oriented program where we review cases of fetal and infant deaths that occur at the local level and looking for systematic and psychosocial contributions to fetal and infant deaths. And not just to see what caused the death or what might have led to it, but what solutions we can come up with as clinicians and as a community. After a clinical review team looks at the cases and comes up with recommendations, there's actually a community action team made up of families, church members, police, anyone in the community who's interested in the health of children and babies. And that community action team takes the recommendations of the clinicians and finds ways to implement those changes on a community level. There have been significant improvements in our community as a result of the FEMUR program that I've been really moved by. Our hospitals have adopted safe sleep programs where they're educating every parent before delivery about sleep-related deaths. They've expanded prenatal education. There's been greater focus on maternal smoking and maternal drug use and neonatal abstinence syndrome. So there's been some real changes that have occurred both at the community and hospital level by participating in the FEMUR. As an OBGYN, I've also changed my practice after reviewing these cases and learning more about what contributes to infant deaths in my neighborhood. As an OBGYN now, I am actually counseling patients about safe sleep. I've learned that this is one of the leading causes of preventable infant death in our state and also within the United States. So now I routinely talk to my patients about, do they have a safe sleep environment for their babies? I counsel them about the ABCs of safe sleep, that all infants should be sleeping alone, on their back, and in a crib, and a smoke-free environment. I'm definitely encouraging breastfeeding, and for families who are formula feeding, I talk about the use of pacifiers and how that can help reduce SIDS. This is something I routinely do in my practice now. At the postpartum visit, I ask where babies are sleeping and what position they're sleeping in, and I've definitely seen a change in my patients on how they're caring for their babies as a result of this counseling. I definitely encourage OBGYNs to get involved with the Fetal Infant Mortality Review Program. There are over 200 active FEMUR programs across the United States in over 40 states, and there's opportunity to start FEMUR programs if they're not active. And OBGYNs really should be involved because we're able to lend our expertise and make a significant impact in how moms receive prenatal education and the advice that they receive in caring for their babies to help reduce the risk of infant mortality. It's been a really critical part of what I do as an OBGYN that I find to be very meaningful and has significant impact on the lives of the families I take care of. The Fetal Infant Mortality Review Program really focuses on the systems level changes that can be made to reduce the risk of infant deaths. So it really forces clinicians to go outside of their office and their one-on-one patient interaction and think about what changes can be made on the hospital level, on the state policy level, that will improve birth outcomes. We also have to think of ways to work together and collaborate with partners in other fields of medicine. Clearly, OBGYNs and pediatricians have to partner very closely in both the care of babies and preventing infant deaths. We also have to work with hospitals, legislators, community members. So it brings us beyond just our one-on-one clinical interaction to think about what are the changes that can be made that will really make an impact at a state level. When we look at infant mortality rates, we don't just do it on a one-on-one basis. We're looking at our whole state, we're looking at the whole country. And there are changes that are evidence-based that can really reduce the risk of infant deaths that we learn from participating in the femur. But we want to see those changes happen at a population level, and we want them to spread quickly. So it's important for OBs to partner with other clinicians and for hospitals to actually work together for continuous quality improvement. It's about spreading that change far beyond that one-on-one patient interaction to what's going to make an improvement that's really going to drive down infant deaths in our state. In Mississippi, we have seen hospitals adopt safe sleep policies. We've seen improvements in our breastfeeding policies. And all of these changes are going to go towards affecting future generations to come. And hopefully we will see reductions in infant death as a result of these changes that the femur has really encouraged. This is how I practice.